Most suction catheters are pretty much the same. If you look in your book, they show you a couple of different kinds at the bottom of page 330, but they're only referring to the tip and the way the tip is actually made. Suction catheters are made of a very pliable plastic. They're very soft. They're usually about 22 inches long. They're very long, so you can go all the way down. It's not important. It's the width that we're more concerned about. You have at the end of it, you have a port at the very end, and on the sides you have two little holes that are usually referred to as Murphy eyes. The reason you have three holes here is so that you're going to get all of that mucus, all of the secretions that are in the airway, and sometimes you're going to be twisting the catheter, sometimes you're going to be hitting against the carina with the tip of the tube. So you still have these, so that you're not applying direct suction onto that area. You also have the little Murphy eyes so that you're not applying all of that suction to any of the mucosa, and you're suctioning in from the side. You have a thumb port so you can control when you're going to suction.
Is that the port that you were talking about? The port at one end is with the thumb port?
Yeah, this is the thumb port. And then you have the holes on the other end that are your Murphy eyes. So this is referred to as just a straight suction catheter. They come in sizes ranging from about a 6, and they come in what they call French sizes as opposed to millimeters. We'll notice when we start measuring using airway equipment, they measure the sizes in different ways. Most of your ET tubes and tracheostomies are in millimeters. Your suction catheters are measured in a thing called French size, so it's like a 6 French and 8 French. Why they say French, I don't know. This is another version of a suction catheter, but if you see it has a little bit of a curve at the end. This is called a coude, C-O-U-D-E. C-O-U. The whole purpose behind this one supposedly is that it kind of curves a little bit so it's easy to get into the main stem bronchus rather than going right to the carina. Whether or not this is really true has yet to be proven, but they've been using these for quite a few years now to do just that, to get into the main stem bronchus, the right or the left main stem bronchus.
So is it usually like each hospital has their own preference, like what they prefer to use, or you'll have your choice of what you want to use?
No, they usually just buy one kind and they all use the same kind. Whatever hospital, whatever kind they use in that hospital is the kind that they have. But they will have it in different sizes. Okay, the preferable for your adult community for nasotracheal is usually a 12 to 16, 12 or 14 or 16. They go up to as high as an 18, but you will rarely see that. For those of you that will be working in the pediatric community, you will see an 8 or a 10 or a 12. And in the neonatal community, as I said, they go down as low as a 6. And as a matter of fact, I think I have one of those here as well. At least I did have.
Pediatric?
6.
Okay,
No, pediatric
this
is 8, 10, 12.
That I'm showing you here is a 14. And this one, and it tells you right on the package, this is an 8. This is the size that you would use like in the pediatric neonatals a minute. You see the difference in the size here. They're almost as long. They're very small, but they have centimeter markings on so that you know how deep you're going into that little baby's airway.
So they're all the same length?
Pretty
I mean, obviously that's going to be smaller, but it's not about the length, it's about the width.
Right. And then, of course, these are your inline suction catheters that we'll use with people with the bypassed airway. Just like the other ones, they come in different sizes. So we're going to look at those in just a minute. Then you have your oral suctioning. Sometimes when the patient, they got a lot of secretions, they can cough it up to the back of their throat, but they're not unable to get it out. And then you give them the Ballard. I'm sorry, not the Ballard, then you give them the tonsil suction. Alright. This is the one that you just go into the back of the throat. If they can cough, they can just get it up to the back of their throat, but they can't spit it out. This is usually kept at the patient's bedside. You may even see the patient doing it themselves. You keep it at the bedside so that they can just,
it's called a tonsil suction.
Or the yank out.
Yeah. Most people call it tonsil suction. Yank
What?
out is the official name
Yank out.
for it.
How do you spell
Through the
that?
back of the throat. And this is another version. One of the problems with this, once you open the package, it kind of like, it's contaminated, but because it's just going in the mouth, you don't have to keep it sterile. So we ask that you're careful to put it back in the package to try to keep it wrapped up. But if you've ever seen it in the hospital, it's hanging out all over the place. You know, if you find it hanging on the floor, please throw it away and just go get another one. But some hospitals will have one like this, and it has this nice little sheath, and this protects it so that it doesn't get all laying all over the floor and wherever it might happen to be laying. Okay, so we're going to look at 3 ways of suctioning. Nasotracheal, endotracheal, using both the sterile method and the inline method, and when you're suctioning a patient with a tracheostomy. We'll start with nasotracheal suctioning. Suctioning is a sterile procedure. It's kind of hard to keep it sterile, so we ask you to be as aseptic as you possibly can. Remember that you're going directly into the tracheal area that is a sterile field, and you don't want to contaminate it. We get accused enough of causing cross-contamination with the patients. So we do want you to maintain asepsis when you're suctioning.